So what's up guys, welcome back to the channel. I hope you're doing absolutely fine. So for my new audience, let me introduce myself. I'm third officer Jessy, working on gas tankers in the merchant navy. So I'm sure you must have heard that merchant navy people stay on land for 6 months and stay on board for 6 months. I'm pretty sure this is a very common myth which is spread worldwide. So just to clear that, this is actually not the case. Sometimes it's 3-4 months. It depends on your rank particularly. So the topic for today is if any crew member falls ill or if he gets himself injured, so what are the medical facilities available on board? So how he can treat himself, what are the medicines available, do we have something called a hospital or not, like do we have some special arrangements for that person? So all these things I'll be covering in today's video, so make sure you subscribe to the channel and stay tuned and watch till the end. So what if I tell you that on board a ship we do have a hospital? Right guys, we do have a hospital on board. So when I was a first time cadet on board, my chief officer told me to go to the hospital and bring something. I don't remember, but he told me to bring something. And I was thinking in my mind that we don't have a hospital on board. So why is he telling me to go to the hospital? And I was thinking that he's trying to play a prank on me. So I asked him, like, what's the location of the hospital? I was like 6 to 7 days already on board. So he told me that it's on your own deck. Like, I was staying on the B deck, second deck. So he told me it's on your deck only. I said, Chief, I did not see it. Like, I'm still 6 days on board, but I did not see it. He said, go and check again, you will see. So I went there, I checked, and there was a hospital. So in today's video, I'll be giving you a full tour of my hospital of this ship, and I'll be showing you all the medical facilities and the medicines that are available on board. And there's one thing that is available only in the hospital, and nobody else has that in his cabin on the entire ship. So let's go and show you the hospital of our ship. So guys, we are on the upper deck right now. This is the lowest accommodation deck of our ship. So this is the entrance to the hospital of the ship. So guys, this is the hospital of our ship. It's pretty small, but it serves the purpose. So you can see this full area is dedicated as the hospital, and nobody stays here without any like serious injury or serious illness. You know, you cannot stay here for leisure purpose. This is dedicated only for medical purpose. So let me show you all the things that we have here. You can see there are 2 stretchers. One is the new one is the old one, and you can see it's clamped to the bulkhead of the ship. This stretcher, basically it's called the NEIL-ROBERTSON stretcher, and here is a poster for that same. Here you can see how to fix it, like the arms should be inside the stretcher here. And then you can see here the NEIL-ROBERTSON stretcher, what I was talking about. Then here we have one cabinet for the COVID PP. So let me open it for you. So here we have all the personal protective equipment related to protect us basically from COVID-19. So you can see all disposable gloves, lots of sanitizers, and some face shields, face masks, everything like body suits. Then we have one extinguisher as well. Then here we have one medical waste bin. The main thing here is this bed and this oxygen setup. So inside this we have a big oxygen cylinder, and which basically can be used to give oxygen to the crew member who is ill. Like if he gets severely ill and requires medical attention, requires oxygen, so we have a facility to provide that. So just adjacent to the bed is this hospital alarm. You can see here this red button switch. So when the person who's staying on the bed, he wants to call somebody, he can just press this button and there will be alarm on the bridge and somebody will come to assist him or look after him. And then here you can see one small cabinet with first aid kits. So all the first aid kits are kept here. In this blue box we have blow tubes for the alcometer. Let me show you. So all these are the mouthpieces, tubes for the alcometer. So we basically connect this mouthpiece on the device alcometer, and then we test for alcohol content. You connect this mouthpiece or the blow tube in the alcometer, and then you blow into it, and it shows a reading, digital reading like 0.00. This shows the alcohol content is 0 in your body. So like this, we have some random checks from the company sometimes, or sometimes if the master suspects, he can make a random check of any person, any crew member on board. So for that, we have a specific device called the alcometer. Next up, you can see on this table there's one specific book, International Medical Guide for Ships. So in this book you can refer to anything, literally anything. There's everything mentioned in this book. This is like a Bible for medical. It's very nice book. Then here we have the fridge. We don't have anything like nice here, only medicines. Like you can see some ampules, some injections like that are kept here. In this drawer we have this medical logbook, in which basically we record like any medicine which is issued to any crew member. We just write what are the symptoms, and then we write the name of the medicine, what was the treatment given, and we just keep the record in this logbook. Guys, you can see these two big cabinets, and inside them there are a lot of shelves and drawers on which the medicines are arranged nicely. So you can see these are some of the medicines. Also here we have a few medicines. Then at the bottom we have some drawers and shelves on which these medicines are arranged. Just have a look how nicely these medicines are marked, labeled and kept, so that in case of an emergency you don't have to run around and look for medicine in the entire hospital. You just check the inventory, come to the specific drawer or shelf and just take that medicine and give to the concerned crew member. Also guys, there are some medicines which are not kept inside the hospital. These medicines are called controlled drugs or narcotics. So all these special medicines are kept with the master, with the captain, inside his master's safe. So in my company, chief officer is the one who is responsible for upkeep of the inventory and checking and removing all the expired medicine from the hospital. So he's the one who is looking after the whole medicine setup on board. There's one particular thing that's available only in the hospital, and I will show you now what's that. What's the thing I was talking about in the beginning of the video. So let's dive into this room. Okay, so here we have this bathroom. The air freshener here smells really nice. So this particular thing I was talking about, this big bathtub you can see here. Nobody on the entire ship, I repeat, nobody on the entire ship, not even the captain, has a bathtub in his cabin. So it's available only inside this hospital. There is a shower too. There's a tap as well for the hot water and cold water. There's a regulator, temperature regulator here, cold and hot. I don't know if you can see the signs. And this bathtub is not for leisure purpose. You cannot just come here for taking a bath. It's for medical purpose only. So then here we have this wash basin, and pretty much this is it for the bathroom. So this hospital, particularly this place, is the most seldomly used place on board ship. Sometimes even for years nobody comes and stays in this hospital, but when things get serious and somebody gets a serious injury, somebody falls and hurts his back or something like that, then maybe they have to be transferred to the hospital. So I hope you liked today's vlog and you liked the tour of our hospital, and if you did, then make sure you hit that like button, subscribe to the channel and share it with your family and friends. Let them know that we have a hospital too on board our ships.